We do have a bit of time to go through some questions that haven't yet been answered in the chat. The first one's just about access to an oximeter. From my understanding, and I'll maybe get maybe Ben to clarify this, I think they're hard to come by, the pulse oximeters, even for those that are in the medium pathway. So, and once you're requiring one, you probably shouldn't be on a low pathway. But I'll hand over to perhaps Ben. Is that your sort of question?
Yeah. So look, yeah, I'm happy to answer that, and there's a few ways to answer it. Any patient who comes into the medium pathway, we give a pulse oximeter to now. They're actually they've been a bit hard to buy, but I think they're back in stock in a lot of places. A patient can usually purchase one from a chemist, or they can purchase one online if they want one themselves. But I guess based on our risk stratification, we'd hope that patients that are in the low pathway are at low risk of progress, low risk of needing hospitalisation, and shouldn't need a pulse oximeter. Although a number of people say it is actually quite helpful to have, and it is reassuring when you're feeling short of breath, which is a common symptom of COVID, to know your oxygenation is stable. It was mentioned before that you do need to teach patients how to use it. There are a couple of really good resources. The Department of Health is about to release a video, which is a localized patient education video on pulse oximeters. We've also got a kind of a brochure that we can share with people, which explains how to use it.
Fantastic, thanks, Ben. I'll move on to, there's another question here from Anna Current, just regarding Vic Health sending text messages to leave isolation regardless of symptoms. Still coughing on day 10, can they safely leave isolation in terms of infection risk to others? I'll leave it up to one of our 4ID physicians to take that one up.
Look, I can't see anybody else jumping in, but now, yes, it is. The answer is that yes, isolation ends at day 10. The only exceptions to that are, a few very, very particular ones, but not ongoing symptoms.
Fantastic. All right, I think a lot of these other questions have been answered. Evidence there. Here we go. This is for Matt. Are kids who have had previous Kawasaki at high risk of PIMS-TS?
That's a really good question. And no, we don't know. So basically, we don't know. There's no clear flags in terms of predictability for who may develop PIMS-TS, but there is every case of PIMS-TS is reported to a national surveillance program who basically review every case, including the 2 we had over the weekend. So as they collate the information as things go on, there may be more clarity on whether there are specific risk factors such as previous KD. None of the ones we have had previously have had Kawasaki's previously, but that's a great question. We'll find out in time.
Thanks, Matt. Yeah, we've got a few more minutes still. So there's another question here about exemptions. So for non-pregnant patients, how long can we give an exemption from having a vaccine? I had a patient today who said that a friend's GP gave her an exemption for 6 months based on antibody testing from a probable infection last year. Anyone know the exemption rulings from our physicians, or do we have to take that one on notice and get back?
I don't think for COVID you can exempt them on antibody tests I'd have to read through the form again. I filled in very many of those forms and I don't think you can. So
I mean, the fact that we vaccinate people who've had COVID, as soon as they're better, having COVID itself is not an exemption criterion.
So I think that sounds slightly dodgy to me.
Yeah, it's not clear why that initial exemption at all was given. So anyway, we'll move on. What supports here is Monash providing for patients with long COVID? We haven't really touched on long COVID much here. Is there any work in the clinic space for the long COVID patients yet?
So Monash doesn't have a dedicated long COVID clinic like some health services do, but we're very happy to see patients through our specialty clinics, and we'll try and prioritise them through based on what their symptoms are. And most of them will probably end up in the respiratory space because typically the symptoms tend to be, dyspnea and associated things. So just refer them through the normal, specialty referral.
Okay, we just had a comment there saying that COVID is a valid exemption criteria according to the government website regarding vaccines.
So yeah, I think the current the Victorian is 3-month exemption after COVID. You kind of get a golden ticket and you can't be re-exposed, and
all right. Yeah, a couple more minutes. Get asked about ivermectin all the time in general practice. Thoughts about giving scripts to patients? Recommendations? Against? For?
Save it up for something where we really need it, like strongyloides.
I think this is a really important question, you know, and I think we all really need to say no to things like this. You know, there's really good national guidelines now on what to use and what not to use. And I think, you know, we all really, just to give a consistent message, need to, you know, treat our patients as per those guidelines. It was harder previously when we didn't have any proven disease modifying therapies, but, you know, now we have a number of different disease modifying therapies we can use, and we just shouldn't use any that, you know, are not in the guidelines and not supported by evidence and come with their own risks and dangers.
Thanks very much. We've probably got one more time for the last question, and it's regarding any theoretical risks for live vaccines, the example MMR, after recent COVID in the baby. Matt, do you want to take that one up?
Yeah, no. So we would encourage, as soon as the baby's well from their COVID illness, we would encourage vaccination. And
fantastic. And well, we've got time for one more. Budesonide be used for anyone COVID positive? Patsy, anyone have any aversions to that out of our physicians? No. Great. All right.
The criteria in the guidelines give specific risk criteria. So, you know, I think going back to what I said before, you know, that would be where to start. It is a very safe therapy and it is low cost and easily accessible, but I think you need to start with those criteria specified in the guidelines.
Fantastic. All right. Well, I'd like to give a big thank you to all our panel presenters, including Benj Tash, who's joined us from Central Bayside, and all our Monash RD physicians. Thanks very much for joining us, all the GPs, and we hope that's given you a bit of insight into what's going on in the COVID space and going to assist you in managing, you know, further COVID patients or your first COVID patient when they're more than likely going to turn up in the coming months. So thanks very much for joining us, and we'll see you next time.